Hi, okay, so let me see. We are still waiting for people to join us. So it looks like you guys are starting to join in. My name is Naomi Tran. I'm part of Futureology. Thank you guys so much for coming. We have not started our presentation yet, but just hold on tight. All of our speakers are in, and we are just going to wait for our guests to arrive so you guys can hear just great things from our healthcare panel. And I'm going to have an introduction slide over here. So I'm just waiting for more of our guests to join us. Can you get Maddie? She's crying and she's starting to. Hi guys, my name is Naomi Tran. Thank you, Ashley. I just realized that I was muted. For those that have just joined us, thank you so much for joining our panel for the healthcare profession. We have 5 wonderful guest speakers for you guys to listen and to learn from their experience and their education. I am going to wait for some more families and students to come on in, so just hang on tight. I'm helping a presenter get her camera and her mic to be set on. So just wait for a couple more minutes for me. Thank you. Hello? Mm. Oh my goodness, I just Hi guys, I'm having a little bit of technical difficulties. Can I have my panelists just chat hello, say hello, or so that I know that you guys can hear me? Great. Okay. AJ, are you able to hear me now? Okay, so it looks like okay, great. AJ can now hear me. Great. Thank you, Max, for saying hello. Okay, we're going to go get started. We're having a little bit of technical difficulties with one of our guest speakers, but I'm sure she will join us in just a second. Alrighty. So again, my name is Naomi Tran, and I'm here to just to introduce you guys to 5 healthcare professionals, and I'll be asking them a series of moderated questions. I'll introduce you guys to them in just a bit, but I want to be able to sort of share with you guys about Futureology and our program. My name is, again, Naomi Tran, and part of Futureology, we provide college and career counseling. We do provide one-on-one counseling appointments to all our high school families. We're located at the Shops of Mission Viejo. And on top of that, we do provide a lot of webinars, workshops related to college and career planning. So if you guys wanted to check us out at www.cusd-futureology.org, you guys can definitely go ahead and do that. And I'll be actually sharing with you guys more about our upcoming events again. But I want to go ahead and lead you guys to our panelists. So just out of curiosity, who is in the panel right now? I'm going to start a poll of who's in the room. So go ahead and let me know who you guys are. Are you a freshman? Are you a sophomore or a junior? Okay. So who is in the room? Do you guys see the chat box in the right of the poll? Okay. All right, so not so sure who's in here, but I do see some in the audience. Hopefully you guys will be more than open to letting us know who you are. Just to give you guys a heads up of housekeeping, I'm going to ask the moderated questions. I'll give you guys a chance to ask a Q&A, a chance to ask your questions during our Q&A time. So the moderated questions will probably last around 45 minutes and leaving 10 to 15 minutes for you guys to ask your open-ended questions. All right? Sorry. Hopefully, okay, it looks like Sally is on. Sally, if you can write in the chat box, let me know that you can hear me and you could see me. While I'm waiting for Sally, I'm going to go ahead and introduce our panelists. I'm so excited that everyone was able to come out. They have been so busy and they have been so gracious to take their time just to share with you guys about their experience. I'm going to actually go ahead and first introduce you to Ashley Nelson. She is, Ashley, if you are able to turn on your mic and your camera, that would be really awesome.
Yeah. Can you hear me?
Yay, there's Ashley. Ashley is our ER nurse, and you guys can see through the slide that she's been working in the hospital at St. Francis Medical Center, but her job is super unique. She is a travel nurse where she's able to travel to multiple hospitals working there and making it very flexible for her to travel. She's actually in Peru right now. So we're so glad that you are here. Next, Graham, if you want to say hello, Graham is going to be sharing about the position of a physician assistant. He is the academic program director. And he has also been the assistant professor at the University of St. Augustine. He has been helping students who are planning on being a physician assistant and brings over 17 years of experience. You guys will definitely get these slides later on so you can hear and see his full bio. Okay. Next, we also have Elena Lay. She is a certified child life specialist at UCLA Orthopedic Institution for Children, where she advocates for patients and preparing, children and adolescents for surgery. And she's also a professor at Azusa Pacific, teaching and a lot about the child life profession as well. So let's say hello.
Hi.
Thank you. All right. Hopefully Sally is on. Sally, can you turn on your mic and your camera? Like I said, Sally's been having a little bit technical difficulties, but I see her present, her mic and camera isn't working. Hopefully by the time as we're going through these questions, she'll be on and ready for us. But she is actually working all the way up in Sacramento in the behavioral health organization as a regional clinical director. And she oversees a lot of staff under her. And so she is very familiar with different kinds of positions under behavioral health. Last, we have Dr. Josh Wang. Hello, how are you doing?
Good, how's it going?
Yay, and he is actually around here locally. He is a Kaiser Permanente family medicine physician, and he's done a lot of training in newborns, children, and adults and seniors, and so excited for everyone to be here. Awesome, thank you. So I know I did like a really quick run through, but I would love for you guys to just share more about who you are. The very first question, we can start off with Ashley. Would you mind going ahead and doing that for us? The first question I have for you is just, what, again, is your profession, a quick summary of your role and what you do in your position. If it helps to just describe your day-to-day, you can definitely do that too.
Yeah, sure. So hi, I'm Ashley. I'm originally from Kansas City, Missouri. I'm currently living in San Francisco right now. I'm on assignment there in an emergency room. I've only ever been an emergency room nurse. Specifically, like the last 2.5 years, I've been a travel nurse. So what that means is I basically sign 3-month contracts in different emergency rooms across the US. I pick the city, I see what contracts are available, and I'm able to work for that hospital for anywhere from 13 weeks to I've even worked to a hospital for almost a year. So that's about me. That's it right now. I'm in Peru right now, so I'm having a hard time acclimating, but let's see, what else do you want to know? What I do day to day?
Yeah, day to day. How many hospitals are you, traveling when you're because you're a travel nurse? How often or how many hospitals do you have to go through?
So they're usually just one hospital every 3 months. Right now, I work at 2 different hospitals. I work in San Francisco at a facility, and then every now and then I'll go back down to LA and I'll pick up a few shifts at a hospital that I recently was on assignment with. But really, you only have to commit to one hospital. But day to day, being a travel nurse is pretty like regular emergency room nurse. You just have to kind of jump into it a little bit quicker. You have to you get less of an orientation, and you have to be comfortable just being thrown into any position, because these hospitals that you're going to visit are usually hospitals that are really short-staffed. So they desperately need your help. So you just have to be really flexible and just help out however they need to.
Yeah, thank you. Elena, would you want to go next? And please let me know if I need to repeat the question again.
Sure. So just.
Oops, sorry, there's echoing. So if
Can you
someone
hear
wants
me?
to turn off the mic.
Can you hear me?
Yes.
Okay, perfect. So first of all, I wanted to thank Naomi and for the rest of you who are and they ask what? What is that? So my job in the hospital is I am kind of like a teacher slash therapist. My role is to help minimize trauma, reduce anxiety. That looks a lot different from every child that I meet. Some children, I need to help them understand their surgery. So I'm going to prepare them for their surgery and explain what they're going to see, feel, hear, taste, smell, all of that. So I explain all of that to them in developmentally appropriate ways so that they feel better equipped while they're in the hospital. And we know from research that if children and adolescents are prepared throughout their time in the hospital, they essentially cope better. And so my goal is to make the hospital experience as easy as possible for them while they're there, whatever that looks like. And I can answer more specific questions at the Q&A if you all have more specific questions, because like I said, it's very specific. My role is very specific to each child and family that I meet. So it's hard to kind of sum it up. But that's basically my role, is to explain what the child is going to experience in the hospital, and then find out ways to best support them while they're there.
Thank you so much, Elena. Graham, would you like to share more about the physician assistant and your role?
Sure. Thanks, Naomi. And I love the panel, and we got a great group here. So, so the profession is called physician assistant, and what we do, one way to describe it is we walk, talk, and act like a doctor, but we don't have the same exact training. We definitely have a different level of our roles and our ability to care for patients. But in our profession came about 50 years ago. We're very similar to what our scope of practice, what a nurse practitioner does. We're able to see patients in a clinic. We do our history, physical exam, diagnose, treatment, prescribe medication. We can order lab tests, at the radiology reports. We have a panel of patients typically within a family practice group that we take care of. We work in collaboration with the physician. So our professional initially started to assist in helping primary care and see more patients. We've since really progressed, and you'll see PAs in every specialty working side by side with docs. The one thing that is a misnomer a little bit is that PAs, are assisting the physician. Right now, we're working in collaboration. We see patients autonomously. We do have the ability and training to do many parts of the healthcare treatment plans. So just so you know that, we have a master's level of education. And so our typical day is wake up, go to work, look at what your schedule is, and see patients all day. Now, if you're in a specialty, you could be working neurology, cardiovascular surgery, et cetera. So we have some options to go into a specialized area. Usually you'll have to do extra training or extra kind of an internship to help you acclimate to that specialty. But we are trained very much like Dr. Wang in a broad base of medicine. But of course, his level of expertise is higher than ours, and he's got a residency as a physician. So I don't want to confuse us as saying that we're residency trained physicians, but we do see very similar types of patients. We're not delivering babies, and we're not doing the most complicated patients, but we are seeing patients as you would expect. I could see your mom or dad. I could be working in an ER room, or emergency room. I could be working in surgery. I could be working in any kind of specialty. But I was a family practice PA. I loved it. I love taking care of families and patients every day. But you wake up, you see patients, you do your notes, and you communicate that way. So I'll try not to take too much longer. I don't see anybody jumping up and down. So
thank you so much, Graham.
My role now, I'll just quickly say, my role now is I'm the director of a developing program, PA program. So it's just an academic environment where I'm making it so that I can, our university can train PA students.
Thank you.
That's all.
Thank you so much. Josh, would you like to go ahead and share about your position and your role and the things that you do?
Sure. Thanks again, Naomi, and everybody for being here. I'm Joshua Wang, and currently I'm a family medicine physician for Kaiser Permanente. So I guess, Graham said it pretty well in that, we kind of do the full breadth. So we see people from babies all the way to the elderly. I have a few patients that are over 100. So I typically don't see babies anymore, although that was part of my training. So I will see kids, usually around 4 and up. But typically my day consists of, getting in around 8:30. I'll scan my schedule and then kind of see what's coming in. And, it really just kind of depends what walks in the door that day. It could be just an upper respiratory infection. It could be a physical exam, or somebody could be having a heart attack potentially, or, be severely dehydrated, or sometimes some patients need, support for their mental health. So you kind of have to be ready for anyone to walk in the door. And I guess, one of the challenging things is deciding, if somebody needs to go to the emergency room, or if it's something that you have a little bit more time and you can work with the patient. So, that's my typical day. I do a lot of procedures in my clinic too, knee injections, shoulder injections. Sometimes I'll take out ingrown toenails. Occasionally I'll work urgent care, or I do evening shifts, what we call after hours clinic, where patients make same day appointments in the evening. So it's a lot more rapid paced and you have to make decisions kind of on your feet. So yeah, that's my typical day.
Great. Awesome. Thank you so much. We have with the second question, can you guys describe, what kind of educational and or training experience you'll need to go through in this field? Numbers can be really helpful. What would you need during your bachelor's? Is there a master's required or extra education and training? So anyone could start. Elena, if you could start, or Josh, anyone.
Okay, yeah, I can start.
Yeah.
So technically, individuals who want to become certified child life specialists can start off with their bachelor's degree in a field related to psychology, child development, but the field has become very competitive. So it is recommended and preferred to go on and get your master's degree, which is what I ended up doing. And if you don't get your master's, then you just need to, according to this slide that I sent to Naomi, have these 10 college courses in the following content areas. So if you match those or meet those requirements, you don't need to go on and get your master's, but again, it is preferred and recommended. After you get your degree, there is a clinical internship of about 600 hours. Some hospitals have longer. It just depends on their requirements. And then you would take the Child Life Certification exam. So anybody who's interested in finding out a little bit more about the education and training, you can go on childlife.org. And that could give you a little bit more information, but that's the basic training and education requirements for a child life specialist.
Awesome. Thank you so much. Ashley, would you like to go next?
Yeah, sure. So the path I chose, I just did 2 years of prerequisites at a university, or actually I did 3. And then I went to an accelerated nursing program. I got my bachelor's degree. I know there's a couple of other options. There are some associate's degree programs, and there's something they call like a LPN, licensed VOTech nurse. I wouldn't recommend anything but a bachelor's program, because hospitals nowadays are actually phasing out associate's programs just because of certain requirements that they have to fulfill. So I would recommend at least starting with your bachelor's degree. And then, I mean, there's so many options to pursue higher education after you get your bachelor's degree. So I would just recommend taking good care of your grades. And I mean, there's so many options, but at least start with the bachelor's degree and kind of go from there. And then once you graduate, each specialty will have its own kind of training, but wherever it is that you get hired, they will take care of that. So you don't need to worry about it.
Okay. Is there clinical hours that you would have to
Yeah.
do too within while you're getting your bachelor's degree?
Yes, I would say it's not necessarily the content of nursing school it's difficult, it's just the fitting it all in. So I know when I was in school, I was doing at least 24 hours of clinicals a week on top of I was working in the ICU and the ER when I was in school, doing at least 2 days a week there on top of like your coursework, your tests, projects. So there's definitely a lot of clinical work, more so like towards the end of the program, but the first 2 years, there isn't any. So I guess I would prepare for that. The final 2 years are pretty time consuming.
Okay, thank you.
Yeah.
All right, our cameras seem to have turned off, but I think we can all still hear everyone. Josh, would you like to go ahead and just share more about your education and the training part of becoming a physician? Hello? Uh-oh.
Hello, can you hear me?
Oh, yes, I can hear you.
Sorry, my mic was off.
Oh, that's okay.
Okay, so to become a physician, you do need a bachelor's degree. So that would be 4 years of undergraduate. And, you know, there's people that are in all different types of majors who pursue medicine. I've met people who are history majors, English majors, engineering majors. The majority of the people, I would say, most likely fall under the biological sciences. And so that's what I actually studied at UC Irvine. I was a biological sciences major. And after you get your 4 years, you will take an exam called the MCAT, which is for admissions into medical school. So I know a lot of changes have been made to the exam since I first graduated, and it used to be, I believe, a 4-hour exam, and now I hear that it's a little over 7 hours. So that's a pretty big difference.
Yeah.
And back when I took it, there was 3 sections. There was a biological sciences, physical sciences, as well as a verbal part. And then you had to write an essay as well. Now I think it's broken up a little bit differently, but for the most part, you still have your biological sciences, and you have to take your prereqs, so you should be prepared for that. Physical sciences usually consists of chemistry and physics. And then you have your verbal section where you have to, you know, it tests your critical thinking skills for reading. And I'm not sure if they still have a writing section or not. And back when I took it, it was still pencil and paper. Now I think everything is through the computer. So times have changed a lot. And after you get into medical school, so medical school is another 4 years, you spend the first 2 years learning your basic sciences. So that's when you'll learn the pathophysiology and the intricacies of, you know, reactions and how enzymes work and, you know, all the different types of antibiotics. And as you learn that after your first 2 years, then you'll start your clinical rotations, which is your 3rd and 4th year. And at that time, you will also be taking your board exam to get into a residency of your, you know, whichever specialty you decide to go in. So for myself personally, I first thought I wanted to be an internal medicine doctor, which is a physician who works inside the hospital. But after my clinical rotations, I decided that I didn't want to be in the hospital. Not that I don't like the hospital, I just felt very frazzled every time I was in the hospital. So I decided that I was meant more for an outpatient setting. I did consider emergency room as well, because I like the aspect where you have to be really quick on your feet and you have to make decisions and, you know, save patients' lives. In the end, I did choose family medicine because I did a rotation and I really enjoyed seeing the wide breadth of patients from young to old. And basically, I could kind of cater my practice to, you know, what I really enjoyed. And so to this day, I still really enjoy it because, like I said, you never know who walks in the door, and, you know, anything you do makes a huge impact in a patient's lives. So whether it be just counseling them on anxiety or depression, or helping give them an antibiotic to help an infection heal, or just managing a chronic disease such as hypertension or diabetes, and just educating patients. And so as I chose family medicine, that's a 3-year residency. And so I had to rotate through liver babies, examine babies, and work in the hospital as well and work in the clinic. So it really depends on what specialty you choose. If you do something like surgery, that's 6 years of residency. That's after your undergraduate and medical school. Then you have to do an additional 6 years. Some people do a fellowship, which is even more focused after that. So that might be another year or two. So the nice thing about medicine is that when you go into it, you can kind of decide, you'll figure it out by your clinical rotations, usually your 3rd year, in terms of, what really interests you. And then from that point, you can really kind of hone in on what you want to do.
Yeah, great. How long when you're doing your rotations of clinical, like how long do you get for each rotation?
So typically the rotations last a month at a time. So you might spend a month just working in the hospital. And at the time, we had to do calls. So sometimes we'd be like on a 30-hour shift. But sometimes I would just be like in an outpatient setting where I was seeing pediatric patients, and it would just be your typical 9 to 5. So every month was kind of a different thing. And during your 4th year is when you have already kind of decided, okay, this is the specialty I want to do. So you set up what you call audition rotations.
Okay.
So you choose rotations specifically for family medicine, because basically you're trying to impress the program that you may potentially want to enter. So let's say if you want to do surgery, then you would choose audition rotations for specific hospitals and where you may want to attend residency. And that's for them to get to know you, for you to get to know them, and see if you guys are a good match.
Okay. Awesome. Thank you.
Yep.
Graham, would you like to go ahead and share about the educational and the training experience for a physician assistant?
Yeah, sure. So you require an undergraduate or a bachelor's degree that focuses usually on some health sciences. So you need to have a year of chemistry, a year of biology, microbiology, sociology and psychology in your undergraduate education. The PA program is 2 years, and that gives you a master's level education after your enter. So you get a bachelor's degree, science related, or you have to meet the prereqs. You can have a liberal arts or any other degree, but you still have to have all those prereqs, which are very similar to medical school and the prerequisites. An interesting part prior to starting your education, PAs usually need somewhere between 1,000 to 2,000 hours of healthcare experience, direct patient care. So we want you to have already been in the healthcare system and had an idea that this is where you want to go. Once you enter into PA school, which is very competitive, like med school, you spend 2 years. Usually, it's anywhere from 2 to 3 years. The average program is 27 months. You'll spend 1 year doing your didactic training, which is the classroom, and you'll do 1 year of clinical rotations. We have 7 core rotation areas that are 5 weeks each. The didactic phase is very intense. Usually is around 65 units over that 1 year. So if you imagine what you normally do is 30 to 45 units credits in 1 year, you're doing at least around double that during your didactic, your PA school. You get your degree and meet your prereqs. You do your 1,000 hours of healthcare experience. Of course, you fill in an application and apply against many others. And are you guys hearing me okay?
I hear some static, but I don't know if it's everyone else too.
Maybe it's the mic is moving.
Oh, okay,
so then you do.
Better.
It's probably moving on my shirt.
Oh, okay. There we go.
Okay, good. So you'll do the 2 years, 2 to 3 years of education, 1 year in the classroom, which is double full time, and then you'll do your clinical rotations and everything from internal medicine, emergency medicine, pediatrics, women's health, surgery.
Graham, can you hear us or see us? Are you still back on? I hear static. That must be him. Graham, are you able to hear us or see us? Oh, he's going to go ahead and get another set of headphones. So he'll be back, but he can hear us as well.
Can we try to use it for the presentation we got last time here?
We're just going to wait a bit.
Yeah, she should have her card.
We're just waiting for Graham to get another mic.
You know,
Oh, there you are.
can you hear me?
Yes.
Much better. So I'll just not use the headphones. Okay.
Yes,
you want
we
me to
can hear
start from the beginning, or?
Yeah, if you don't mind, that would be really helpful.
Okay. So physician assistant studies usually starts off similar to medical school. You need an undergraduate degree, usually focused in health sciences, where you're meeting all the prerequisites in biology, chemistry, microbiology, social and psych, anatomy and physiology. But you can have another degree as long as you have those prerequisites. So you take your undergraduate degree and you apply, and you have to have 1,000 hours of healthcare experience. And from that, with that 1,000 hours of healthcare experience, you gain the necessary experience to kind of enter into the profession with an understanding of how medicine works generally. You'll go through an interview process and a very stringent competition between many smart people. So it's the average GPA entering into PA school is around 3.57. So grades do matter. Your healthcare experience does matter. Your scores in your science matter. And then typically you'll have 2 years of education after that would give you a master's, and it'll be a master's of science and physician assistant studies, etc. So you'll see the list of the courses that you need to have in your undergraduate or your prerequisites prior to entering into PA school. Once you enter into PA school, it's usually 24 to 30 months. You'll do 1 year of didactic, so much of it's classroom spent. You'll do approximately 65 credits or units, which is in 3 trimesters. So you do 3 15-week trimesters where you are taking about 20 units per trimester in 15 weeks. So that's quite stringent. Your second year, you'll be doing clinical rotations. There's 7 core rotations that you'll take. Each one's about 5 weeks each. You'll do a research project. You'll do your core rotations. You'll usually have 1 or 2 electives. The core rotations include family medicine, emergency medicine, pediatrics, women's health, general surgery. Let's see, and maybe a couple others I can't recall right offhand. So
Okay, that's a lot, but that's what sounds really good.
A lot of fun.
Yeah. With on the the next question that I had, I know that in your role, you guys are constantly helping others, and that is so awesome and rewarding. But would you like to also share, you know, what has been the most challenging thing you guys actually experienced on your job, and how do you handle that? And anyone can start. I think, Ashley, if you want to go ahead and start again, that would be awesome. Oh, Ashley, your mic is off. And Graham, your camera is off. Yes, I can hear you.
Okay. I think for me, the most difficult part of my job is just communicating with people. I mean, it sounds like a very basic thing, but I forget that sometimes, while this may be my everyday life, every day I see people in their worst states, physically, emotionally, and I see all kinds of traumas. I see all kinds of things that this is my everyday. I'm used to it. It doesn't faze me. But for people on the other side of it, the family members and the patients themselves, I mean, this is not something they go through every day. Like, this could be the first time they've ever stepped foot in a hospital. So I think communicating with people is like the most difficult part. Like, it's very difficult to talk to somebody's frantic family member who is there because their loved one just got in a car accident, they don't know what's going on, or trying to explain it to families in a way that they understand and to keep them calm and comforted is probably the hardest part for me, especially very upset and emotional, rightfully so. So yeah, that would be the most difficult part for me anyway.
Thank you for sharing, Ashley. Graham, would you like to go ahead?
Yeah, sure. And giving them the quality care and is probably the most challenging part. In family medicine, you have a close relationship. You usually, develop relationships with these patients and you get to know them. The hard part is you want to tell them more, you want to spend more time talking to them, you want to explain things more, but the system is set up that you have to move fairly quickly, and there's the next patient that comes along, and so that's a big challenging part of the day-to-day life for PAs and family. I would say, additionally, you have to be steady. So you have to kind of maintain a normal. You're having a bad day. Who knows? Your car didn't start. You got a headache, or something's going on. You have to be take each patient like it's they've waited to see you. They finally get in to see you.
Thank you so much, Graham. Elena, would you like to go next about, what has been your most challenging experience on your job, and how do you handle that?
Yeah, so kind of to piggyback off of what Ashley said about working with individuals in a really stressful death is never an easy experience. It's never easy to talk to the families about the death of a loved one, especially a child. And so the way that I navigate that, we talk a lot about self-care in my profession, as I'm sure everyone can say the same in the healthcare profession, that you have to make sure that your cup is filled before you pour out to other people. And so having individuals to support you, being able to communicate your experience